top story tonight, the city of Geneva is believed to be one of the first cities in the state to use federal COVID-19 CARES Act money to buy an ambulance. Tonight, Mike Gerspan says newly sworn-in Mayor David Hayes is also using that money to revamp City Hall's security system.
On average, Geneva EMS has been transporting 5 to 10 seriously ill COVID patients weekly to hospitals as far away as Jacksonville, Florida, Pensacola, and Mobile. Closer healthcare facilities are simply full or don't have the staff to treat these patients. With the additional miles, the city's ambulances are being worn out. Mayor David Hayes says his city will be one of the first statewide to use a portion of its federal COVID dollars to buy an additional ambulance.
And lately, unfortunately, we've been having to run 5, 6, and 7 patients every so often, every couple of days. So there's a lot of going on, and we've completely almost exhausted that rescue. It's broke down twice on us. So we decided, what better way to spend that money than to provide a service that we've already got.
Geneva EMS Director Cindy Campbell says quite simply that the number of COVID patients being transported within a 200-mile radius of the city has simply worn out the current ambulances.
The patients are going to higher level of care, and we're transporting patients up to 200 miles away. And with the hospital staffing and then all the hospitals being on diversion, it's been very difficult for us.
In addition to a new ambulance, CARES Act money is being used to purchase state-of-the-art security equipment for City Hall. Covering local news first in Geneva, Mike Gerspan, WDHN News.
Mayor Hayes says the ambulance and new security equipment should add up to around $220,000. Moving to Coffee County now, the Coffee County Health Department will be giving out COVID-19 vaccines to health workers this Wednesday. Since the Alabama Department of Public Health is still in Phase 1A, the vaccine will be only given to frontline healthcare workers in hospitals and nursing homes, those giving direct in-home or mental health care, and healthcare workers in a setting that could be exposed to aerosols or fluids. Those wanting a vaccine can schedule an appointment with the health department by calling 334-347-9574. Health officials say in the coming weeks, COVID-19 vaccines will become more widely available as we shift into new phases of administration. But the plans for how the general public will get their vaccines have not yet been fully announced. Right now, we are still in Phase 1A of vaccine distribution. That includes healthcare providers and people of high risk and long-term care facilities. But we can expect to shift into the next phase in the next few weeks. That will include high-risk essential workers, first responders, and people 75 years and older.
Things go well and our supply chain stays active, we should be able to start moving into older populations in Alabama, I would guess in the first part of February.
Certainly our biggest factor at the moment is supply.
When vaccinations are available to everyone, Dr. Saggs thinks there will be a website where the public can sign up to make their appointments.